In order to continue this inaugural session, I am happy to inform you that today is World Camel Day, and one of the big person in the field of diabetes research who has worked a lot on camel milk and related research work, Dr. R.P. Agrawal, is with us. He is the ex-principal and controller, senior professor and in charge of Diabetes Care Research Center, SP Medical College. At different national and international level, his research work is being presented and had been honored by Juvenile Diabetes Research Foundation, that is commonly known as JDRF, European Association for the Study of Diabetes, EASD, and International Physician Association. We all know from worldwide that his research on role of camel milk in diabetes is fantastic, and he has published more than 120 research papers in national and international journals of repute. And I am very happy to inform you that when we started some work on milk analysis, we were often used to take their help for the identification of different gene codes, etc. And he has worked a lot related with the camel milk and diabetes work. Recently, he has published one book released from IGI Global Publication USA, Handbook of Research on Health and Environment Benefits of Camel Product. And although I know that he is very busy throughout the day, even then he has accepted our invitation. And one thing I would like to also mention here, that the films produced by our institution on camel milk and research has been under his guidance, and we are really thankful to you, sir. With these words, I request you to kindly say a few words on this particular occasion of World Camel Day. Dr. R.P. Agrawal, sir.
Thank you. Thank you, Dr. Bhojak. Are you getting my voice?
Yes, sir.
Respected patron, Dr. G.P. Singh, our chief guest, Dr. Shahu, Director NRCC. This topic is a really very wonderful topic. We carried out some research work on camel milk and diabetes. I will highlight only few points about that. We carried out epidemiological studies, experimental studies, clinical studies, genetic studies, and proteomics. And interestingly, the camel milk contains 52 units of insulin, and hence we use in type 1 diabetes. Type 1 diabetes is insulin-dependent diabetes. When we give camel milk to that population, it substantially reduces the requirement of insulin, 60 to 70% reduction in the dose of insulin. And to the tune of 4 children out of 12 were without insulin. They were totally controlled on camel milk. This is the beauty of the camel milk. Then we carried out research on type 2 diabetes. Significantly reduces the requirement oral hypoglycemic drugs. It is maybe because of it decreases insulin resistance. There is one interesting community, that is Raika community. They judiciously use camel milk in their diet. And the prevalence of diabetes in that community is very negligible. That is 0.4% only. Otherwise, in the same lifestyle population, the prevalence is 5.8%. Then we carried out proteomic studies, and we isolated 13 proteins and 22 peptides similar to insulin-like molecules. And hence, it is a really boon for type 1 diabetic patients. I wish all the success to the conference. Thank you very much.